Hi, I'm Dr. Milescu. I'm continuing a series on rehabbing a total hip replacement. I'm between 6 and 7 weeks total hip replacement on the left side, 1 year on the right side. What I'm going to show you today is a way to address one specific target muscle called Gluteus Medius. Gluteus Medius is going to help you abduct, meaning move the leg away from the body. So this is called abduction. So I tend to say abduct because adduction is towards the midline. Abduction is away from the midline. So sometimes people don't hear the B in it. So abduct, abduct is away, and then coming back is towards. Specifically, these exercises will address the gluteal muscles. So Gluteus Maximus is your buttocks. Deep to that is Gluteus Medius. So the exercise I'm going to show you today specifically targets Gluteus Medius. Why do we want to target Gluteus Medius? Because A, it helps you move that leg away from the body, so that's important to be able to do, and also helps you internally rotate your thigh. So that is also important because this particular muscle is going to be compromised when you're having a total hip replacement. The femoral head gets replaced with a stem that's metallic and possibly ceramic head, and the acetabulum, which is the hip socket, is going to also get replaced. So we need to get that articulation moving again pretty soon after surgery, but not quite before 5 weeks. So it depends on age, healing capacity, etc. So anterior incision definitely heals a lot faster than posterior incision, because posterior incision you have to cut through all the muscles, the gluteal muscles. So I'm anterior incision. I'm going to do the surgical leg first. This is the one that's between 6 and 7 weeks. And why am I doing that? Well, you want to be able to stabilize this side. And what am I standing on? I'm standing on a balance pad. So this, just standing here and balancing, is going to allow me to strengthen the left hip that was replaced. But more importantly, I have to address Gluteus Medius on both sides. So I'm going to address the contralateral side that is always compensating while this is healing, and make sure that it's strong enough to sustain while this is healing, because this is the hip replacement as well. So what you want to do is, normally most people are going to just abduct like this, all right? And that's great and all, it gets the IT band and all general glutes. But if you want to particularly address Gluteus Medius, you want to turn your foot in so that my right big toe is lined up with my left big toe. So now I'm going to go at a diagonal. Instead of straight out or forward or back, I'm going at a diagonal, and that's going to really put tension with the tension band and the balance pad, really cause isometric contraction as well as isotonic. So this is isometric here, where there's static contractions, strengthening and stabilizing the surgical hip joint. And then isotonic, which is movement and muscular contraction, is going to be on this right side. So let's begin without further ado. The first thing that I do as a yoga teacher and Pilates instructor is check, body check. Body check means postural check. So what you want to do is lift the pelvis up and draw it in. Bring the navel to the spine, create a neutral spine. Don't round that lumbar region, but create a neutral spine. Roll the shoulders down and away from the ears. Engage the abs and start with your thoracic breath that we learn in Pilates, which is flaring out and opening up the rib cage as you inhale, and as you exhale, draw it back in. Always remember to keep that solar plexus, the upper abdomen, completely contracted throughout your breathing cycle. The only thing that moves, drawing in and drawing back out, is your triangle here, your lower abdomen, between the pubic bone, the anterior superior iliac spine, right below the belly button. This is your lower abdomen, this is your core. This is what you always need to engage when you're exercising. I like to use a ballet bar for stabilization. Now, a lot of us tend to slouch. You want to lift this up, cause contraction of your thigh muscles, right here, your quads, your IT band, your glutes, all right? This muscle here that becomes the IT band is called the tensor fasciae latae. A lot of anatomy, but I prefer making sure that everyone knows what muscles are being used. Core in. Here here we go. Turn the foot in slightly at a diagonal. Make sure the big toe is almost lined up with that other, the contralateral side. All right, here we go. So pull out in a diagonal. Make sure you maintain the core, maintain the shoulders down and away from the ears, maintain the neck elongated. All right, so it's all about posture, not about just working the lower extremity. It's a whole body movement here. You can bring the arm out and make sure that you keep your core engaged. So how do we do it when we exercise the breath work? Here's how we do it. Take a deep inhale, prep. Exhale, contract. Inhale, slowly come back in. All right, so exhale. Really feel it in my gluteus medius, and I also feel it in my hip joint here. All right, so that's it for today. I wanted to just show you this particular exercise, post-hip replacement. Excellent. Have a great day, and I'll see you on the next YouTube video.